Hi, I'm Sandra Alexander, and I'm a speech therapist and also the parent of a person with autism. And thanks for tuning in to another MyHana presentation. This is an introduction of the basic forms of ABA instruction and rate-based instruction. So we're going to be talking in this webinar and other webinars about a lot of instructional methods. And you don't have to be an expert. We don't expect it. You don't have to be. But you should have some understanding of these various programs and practices, so you know what, if you're doing ABA instruction and these methodologies, is this appropriate to your child? So if you know that and you have some understanding, you can see if they're doing it right, if the instruction's occurring correctly in the school, and if it's a good thing for your child. So the more you know, the more you can help your child with their education. So let's dive in and learn more. We'll be talking about rate-based instruction. We'll talk about what is behavioral fluency, and that fluency is an outcome and not a teaching method. And it's also an outcome of practice and rate building. So this is based on work by Binder in 96 and 97. And fluency is the fluid combination of accuracy plus speed that characterize competent performance. So as you know, you are probably a competent, a fluent driver. You don't always think about it, even though maybe we should a little bit more aside, but it's fluent and you're very quick at it. So we're hoping to teach that with some skills for our children. And now we'll talk about precision teaching. I hope I say that precisely. So here's a graph. As you can see, there's fluent behaviors that we want them to become automatic, expert, so you don't have to think about it, you're good at it, that you don't have to try so hard to do it, because that takes time, and then you lose other things that you're trying to learn because you're concentrating on working hard, and that is functional and really helps somebody. So precision teaching is a systemic or systematic method. It relies on precise measurement to make decisions regarding what should be instructed and how. So they're measure and also how to grade or regrade curriculum. This measurement reinforces accurate responses to at a high frequency to encourage fluent responding. Okay. So the focus is on fluency. Let's do it quickly. Let's make it automatic. So if we need to adjust the curricula, the content to fit that, can be done for each individual student, and it's individual for each student, of course. So the curriculum won't look the same or the way it's being taught between the students. This is to maximize learning. So for precision teaching is an ABA approach that emphasizes the rate of performance and uses the standard acceleration chart to track progress and make informed decisions based on how the learner's doing. So precision teaching is not so much a method of instruction as a measurement tool, okay? It's a method of evaluating instruction and the tactics being used or the strategies to see if it's working. So remember that fluency is the goal of precision teaching. Are they doing it automatically, quickly, low effort, and is it functional? It's an ABA approach that emphasizes how fast somebody's learning. And now we'll learn more about precision teaching. It focuses on observable and measurable behaviors. It uses rate as a measurement of movements of performance. The measurements capture an accurate learning visual. It uses the standard acceleration chart and charts responses permitted on the standard acceleration chart, or SCC. And it's done by observing the behavior. What happens, the acceleration rate and tracking using this chart produces a more and more accurate learning picture than a percentage, which is what they use for discrete trial data. And now let's talk about rate building. Rate building can be used to address motor deficits. So that could be walking, it could be holding a pencil. It helps to build speed It ensures that the responses are ones that the child has. They can do that already, or they have components of it. And it also increases access to reinforcement. So how do we know where to start with all this? Well, we're going to start with what the learner can do. We'll look at motor skills, skills that need to be fluent, and we'll look at a component or a part of a skill that the child might need to learn as part of a bigger skill. So we're going to look at motor skills, like I said. We don't want to overlook skills that are part of other skills, which is what a component is. And again, it's important to remember that we're not reinventing a wheel here. We're looking at skills a person has, a child has, and we build them and ensure that they're already mastered before we go to the new stuff. So we're going to see what they can already do. So rate building preparation. So if the first thing that's done, or you're trying to identify a response, and once this is identified, this rundown should provide you, this whole thing will provide you with a clear picture of what it looks like to prepare rate building criteria or the goal. So we're going to look at other children, let's say in the classroom. What are they doing? How are they doing it? We'll try to get an understanding of their responses and how long it might take them to perform a response. Then we would time those learners to see how long it takes. And then we would have the learner we're focusing on do that and compare. How are they doing compared to the other children? And we might adjust the goal after comparing what the learner's doing based on what they're doing compared to other children, and consult with the teacher. We need to have an understanding of how the goal is established, because it's important to know, for you to know as the parent, what the goal looks like and to judge whether it's reasonable or not. So, and what I've found clinically is that a lot of tests, of course, are going to compare a child with their normal peers. But if your child has autism, they're not normal. So how valid is that? And you can sometimes build a response that makes it look more, as they say, neurotypical that way, because most tests are comparing two children who are considered neurotypical. And everything's dependent on your child. Often some tests will use measures where you can actually compare a rate of improvement of your child based looking on them only and not comparing to normal children. So just keep that in mind. So more things to keep in mind are the materials for doing this available. Are the charts up to date? Are the expectations clear, not only to your child, but to the parent, to the other teachers, to the instructors, to the aides? Does everybody know what they're working on? Is there appropriate motivation in place? The timer in this task, and the task should be started when you present the stimulus, not before. And the pace should be quick. It looks quick because we're trying to make it automatic. So if you go for an observation in a school, and on an aside here, if your school doesn't want you to observe or they really discourage it, I consider that a bad sign. You should be able to observe. So if they really, really fight you, you may need to move. That's end of that soapbox. But anyway, if you go for an observation and you see staff conducting this kind of instruction, you should see that all the materials needed are there. The timer's there. The charts are up to date. They're tally counters, charts and pencils and data sheets. Everything's there. And you can request to see any charts and see the dates on them as well, so that you have that ready when you go to the IEP meeting, okay? The staff should be letting the learner know what their expectation is. Like, you're going to do this 4 times in 10 seconds, okay? Appropriate motivation is in place. So if your child likes to be cheered on by the staff, that should be available. If they don't like it, you find another way that they do like and have it available. And so when timing, the timer starts when you present the first task, and the staff should be moving quick to see if your child's learning and is it becoming automatic. So an overview of time practice. The skills of time practice is that skills are acquired via instruction. They're practiced every day. Timings are systematically increased as the timing goals are met. So if they can do it in 5 seconds, maybe you'll try to go down to 3. Praise can be delivered during the timings. Continued learning practices, timed practices are done until the learner meets the goal. And then the performance is graphed on the chart and show the learner how their performance compares with the daily goal. Use differential reinforcement. So, so at first the skills are timed with short timings and should be increased, as we just said. And the learner should know what's going on. This is what goes on with a timed practice. So once again, thank you for coming to this MyHana webinar and tuning in. I'm Sandra Alexander. I'm a speech therapist and the mother of somebody with autism. Have a nice day.